baby learns through observation, imitation, and other visual experiences. Vision gives meaning to what a child hears, touches, and smells. Vision promotes early social interactions and play.
Yes, I agree. La 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 la. Oh, yes.
Hi, baby. Hi. I love you.
A baby with a visual impairment may experience a blurry, fragmented, and unpredictable world. These simulations show how visual targets may appear to a child with certain types of uncorrected vision problems. A baby with myopia or nearsightedness may see close objects clearly, while distant objects may be blurry. A baby with hyperopia or farsightedness may see distant objects clearly, while close objects may be blurry. An astigmatism, strabismus, or cataract may also cause poor visual acuity. When an infant has a visual impairment, early identification, relevant intervention services, and ongoing specialized services are critical for later school success. The first section of this program highlights the need for early identification of vision problems in babies and outlines risk factors related to visual impairments. The second section outlines basic visual skills in the first year of development. Need for vision screening. Universal newborn hearing screening is well established. Every state and territory has an early hearing detection and intervention (EHDI) program. However, there is no similar program for newborn vision screening in the United States. The American Academy of Ophthalmology, the American Academy of Pediatrics, and the American Association for Pediatric Ophthalmology and Strabismus recommend vision screening for newborns and at each routine well child visit from 1 month to 48 months of age. The American Optometric Association recommends a comprehensive vision examination between 6 to 12 months of age and at 36 months. Factors that contribute to delay in early identification of visual impairment are lack of universal vision screening of newborns, misconceptions about the newborn's visual skills, symptoms that are intermittent or develop over time. Pediatric and well baby appointments may not include a focus on the infant's vision. Certain vision problems may not be obvious. Typical eye appearance. Let's begin by looking at typical eye appearance and visually related behaviors in very young children. Typical eyes look healthy, appear straight, move together in a coordinated way. Each pupil is black and round. Pupils are equal in size. Typical visually related behaviors. Interest in exploring the environment. Makes and sustains eye contact with caregivers. Holds head at midline if the baby has head control. Plays with toys at arm's length if the baby has motor control.
Sure. Can I borrow your purse for a second?
Got it.
Avoids obstacles while crawling. Early intervention service providers should be familiar with high-risk signs and factors related to vision problems. Concerns about the appearance or movements of a baby's eyes or other unusual behaviors should be discussed with the pediatrician to determine if a referral is needed for a vision examination. Reasons for referral to a pediatric ophthalmologist or optometrist. Unusual eye appearance, such as excessive or sustained redness, tearing, discharge, or swelling. Eye or eyelid droops over, covering pupil. One or both eyes seem to turn in or out. Pupils are different sizes. Atypical shape of pupil or iris. Cloudy lens, cloudy cornea. Rapid or wiggly eye movements. Unusual behaviors include no interest in looking at people or toys, tilts head to side or back when looking, holds object close to eyes or head close to object, squints as if trying to focus, extreme sensitivity to light, uses peripheral vision to look at object. Unusual looking behaviors. At-risk conditions. Infants with certain diagnoses may be at risk for a visual impairment and should receive a comprehensive vision exam. These diagnoses include albinism, cerebral palsy, hydrocephalus, infectious diseases, for example, meningitis, encephalitis, prematurity, anoxia during birth, rubella, seizures, specific syndromes, for example, Down, charge, and head trauma. Common terms and definitions. Functional vision, the ability to use vision to plan or accomplish a task. Legal blindness, a measurement of distance vision defined as a visual acuity less than 20/200 in the better eye after the best possible correction, or a visual field limited to 20 degrees or less, even if acuity is normal. 20/200 means that a person sees at 20 feet what an individual with normal vision sees at 200 feet. A visual field of 20 degrees is similar to looking through a narrow tube. Low vision covers a range from mild to severe vision loss, includes individuals who have some functional vision and may be legally blind. Light perception, LP, ability to perceive light but not necessarily locate light source. No light perception, NLP, inability to perceive light. This chart shows the hierarchy of vision function. Cortical visual impairment, CVI, refers to the brain's inability to perceive or decode visual images. CVI is a result of a cerebral injury. The eyes and the optic nerves may be intact, but the visual cortex, which receives and decodes visual images, is affected. Visual functioning may range from no apparent vision to intermittent vision that may be transient or permanent, depending upon the age at onset and the severity of the injury. Vision specialists. Ophthalmologist, a physician, MD, who specializes in the medical and surgical care of the eye and may prescribe eyeglasses and contact lenses. Optometrist, a healthcare provider, doctor of optometry, OD, who specializes in the assessment and treatment of vision problems and may prescribe eyeglasses and contact lenses. Optician, a professional who specializes in fitting and dispensing eyeglasses and contact lenses as prescribed by ophthalmologists or optometrists. Ocularist, a trained technician who specializes in creating and fitting ocular prosthetics, artificial eyes. The following 2 educational professionals should be included on the Early Intervention Home Visit Team. Teacher Certified in Visual Impairments, TVI. An educational professional certified in providing specialized instruction to meet the unique learning needs of children with visual impairments. Certified Orientation and Mobility Specialist, COMS. A professional who is trained to teach children with visual impairments how to establish and maintain their position in space, orientation, and how to move about safely, mobility. This section outlines the basic visual skills developed in infancy and highlights selected skills on the Developmental Vision Screening Checklist of the PAVI Manual. This checklist provides an easy tool for observing a baby's use of vision during the first year of life. These visual skills are indicators of how an infant uses near-point vision, 8 to 12 inches. These skills are usually acquired by 6 months of age in typically developing sighted infants. Fixation, maintaining a focus on an object using central vision. Tracking, visually following a moving target. Scanning, visually examining a group of objects. Localizing, visually locating an object against a background. Shifting gaze, looking at one object and then another. Eye-hand coordination, reaching for what is seen. Developmental sequence of early visual skills. Birth to 1 month. Fixates on face, hands, and tracks with head and eyes. Does the baby stare at the caregiver's face? Observes movement in room.
Oh, yeah.
Does the baby track or follow movement around the room?
Nose in my mouth.
Stares at light source. Does the baby stare at a light
You
source?
see the lights? You see the lights?
2 months. Looks directly at caregiver's eyes.
And a 3.
Does the baby make eye contact?
La 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 la. La 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 la.
Watches lip movements.
Abu. Hi. La, la,
How
la,
does the
la,
baby
la.
respond to normal and exaggerated lip movements? For example, mouth wide open, tongue stuck out.
Oh. La. Yes. Oh, yes, hello. You got my nose. You did. You got my nose in my mouth.
3 to 6 months. Watches own hand movements. Does the baby watch her own hands? Alternates gaze from one object to another. Does the baby shift gaze back and forth between objects? Approaches mirror image. How does the baby respond to looking in a mirror? For example, stares, smiles, reaches.
Ooh.
You want to give yourself a kiss? Mwah.
Reaches for caregiver's face.
Oh. La.
Does the baby reach towards the caregiver's face?
Oh, yes, hello. You got my nose. You did.
Tracks rolling ball. Does the baby visually follow the rolling ball? Stare at the place where the ball was last seen? Turn to look for the ball when out of visual field? Reaches for dangling toy. Does the baby reach for and grasp the ring at midline, to the right side and to the left side?
Get it. Get it.
7 to 10 months. Looks at small object.
Fishy.
Does the baby look at a very small object?
Yeah.
Attends to scribbling or writing.
Look, I'm going to write your name.
Does the baby watch the caregiver scribbling on paper?
A. She in the ocean. Swimming through the water. What's that?
Looks at pictures in book.
Let's go to the next page. Cookie is blue from head to toe, and so is the sleigh that glides through the snow.
How does the baby respond to pictures in a book? By looking, pointing, or vocalizing?
Do you see the snowman?
With the scarf
Ooh. And the bird on his head?
and Cookie Monster.
11 to 12 months. Explores depths by looking in a container.
2, 3.
Can you find it?
How does the baby respond to an object in a container?
There it is.
Recognizes familiar objects across the room, 8 to 10 feet.
Ooh, come get your ball.
How does the baby respond to familiar objects across the room? Staring, vocalizing, reaching, pointing, or moving towards the desired object? This program emphasizes the importance of observing how infants use their vision in everyday activities, identifying vision problems as early as possible, Making referrals to early intervention and specialized vision services to ensure that very young children can achieve their best learning outcomes.